To the keto side, we have bacon.
Bacon from regeneratively raised pigs. Today's interview, Natalie and I speak with Dr. Sarah Myhill. Dr. Myhill is a renowned British physician specializing in chronic fatigue syndrome, ecological medicine, and nutrition-based healthcare. With decades of experience, she's authored numerous books, including Diagnosis and Treatment of Chronic Fatigue Syndrome and Sustainable Medicine, which challenges conventional medical approaches. Dr. Myhill advocates for patient empowerment, emphasizing diet, lifestyle, and mitochondrial health as foundations for healing. Her work is centered on addressing root causes of illness rather than merely managing symptoms. So without further ado, here's our interview with Dr.
One more
Myhill.
thing. Do you want to boost your energy, mental clarity, and focus in just 30 days? Click the link below so that you can download my free guide with 6 simple changes that are going to help you feel amazing and confident. And if you're ready to dive deeper and uncover the root causes of your symptoms, book your free 45-minute exploration call today at nutritionwithconfidence.com. All right, enjoy the interview.
Dr. Myhill, thanks for being on the podcast today. I wanted to start off by talking about symptoms. Maybe you could explain how conventional medical doctors typically view symptom development and treatment in contrast to your view on symptoms development and treatment.
Okay, well, conventional medical doctors are very naughty because they routinely muddle up symptoms with diagnosis. Symptoms is a clinical picture, it's what you see. Diagnosis implies a mechanism, i.e., the underlying cause of that symptom. So, very often patients come to me and they say, I've been diagnosed with irritable bowel syndrome. It's not a diagnosis, it's a clinical picture, which may be characterized by pain, indigestion, wind, gas, bloating, whatever. We have to ask the question why. Same with my special area of interest is chronic fatigue syndrome. People say I've been diagnosed with chronic fatigue syndrome. Chronic fatigue is not a diagnosis, it's a clinical picture. We have to ask the question why. Like same as dementia, doctors kind of diagnose dementia as if that's, it isn't. Dementia is a clinical picture. We have to ask the question why, Is it poor energy delivery mechanisms to the brain? Is it in chronic infection like Lyme disease? Is it a prion disorder? Is it poisoning by heavy metals or whatever? And that is where conventional medicine has gone horribly wrong. And the reason it's gone horribly wrong is because doctors are now educated by big pharma. And what big pharma want to do is they want to sell lots of drugs, follow the money. The only responsibility of big pharma is to their shareholders, not to patients. And big pharma produce symptom suppressing medication. And the problem with suppressing symptoms is that you don't address the underlying pathology, which then accelerates even faster. So, medicine always used to be, work out the reason why and address that. No longer. So this is why really what I'm advising people to do is work it out for yourself. Work it out from first principles, what your symptoms mean, what are the cause of the symptoms, and then do the detective work yourself. And this is called naturopathic medicine or functional medicine or ecological medicine. It's got lots of different names, but the basic thing is the same. A very, very useful website is the orthomolecular medicine. Now, it's a dreadful name, orthomolecular. It just means the right molecule. The point being here is if you can work out the right molecule that's needed for things to work more efficiently, or is blocking, or is getting in the way, or is responsible for inflammation, or whatever, then of course you can address the cause. And it's a lovely website. It's free. Anybody can get their newsletters for nothing, and it's not a money maker, but there's some very useful clinical information there.
Amazing. I'm wondering what you would say to somebody who doesn't have a diagnosis, but it wants a diagnosis so badly, right? People who feel so ill and they keep going to doctor, trying to get that picture of like an explanation. What would you say to someone?
What I say to them is do it yourself. I mean, there's so much information there. I mean, I've written books. There's all the stuff on my website, which is free. Anybody can access it. And, always ask the question why. And my view is that most Western pathology, whether it's arthritis, migraine, chronic fatigue, cancer, dementia, heart disease, most disease is driven by two prongs. One is poor energy delivery mechanisms. And we could talk all day about that, and I often do. And the other is inflammation. And the problem with the modern world is it's very pro-inflammatory. It tends to switch us into an inflammatory state. So sugars and carbohydrates are markedly pro-inflammatory. We're all deficient in vitamin D, which is a really important anti-inflammatory in the body. We're all deficient in iodine, again, another important anti-inflammatory. We're all deficient in vitamin C, again, another important anti-inflammatory. And when I do tests of toxicity, I very, very rarely find a normal test. We are all poisoned with pesticides, chemicals, volatile organic compounds, heavy metals. So, we should all be doing some sort of detox regime to reduce the total load. And sometimes people come to me, and of course, what everybody wants to hear is, oh, you've got Lyme disease, we'll get rid of that and you'll be fine. Oh, you've got boron deficiency, that will get rid of the arthritis. They want, single answers that you just pop a pill and that's it. It's not like that. Life is not a battle, it's a war. It's a war that we have to fight harder and harder and harder as we age. It's a war we know we're going to lose. But if I lose that war when I'm 102, then I will settle for that. And I say 102 deliberately because for the last 7 years, I've been looking after an old boy who's been occupying my granny flat. And he was on a paleo-ketogenic diet for the 7 years he was here. I was giving him supplements. He died in his sleep, age 102. He had no dementia, no cancer. He had a strong heart. He just pegged out. So, we have the tools of the trade. We have, as I call it, the rules of the game for people to live life to its full potential. So even if you're not sure how to go about treating your disease, the starting point, the basic package of workup is pretty standard, and we can go through that if you wish.
Yeah. You mentioned one of those prongs was inflammation there. And I was joking with my friend a few months ago how inflammation just seems to be this catch-all term that's used for anything that someone just views as unhealthy. Could you actually just give the definition of inflammation? What's the definition, and what then are like the key inflammatory environmental factors?
Inflammation occurs when the immune system is activated and busy. And it can be activated and busy because of allergy, because of chronic infection, because of upper fermenting gut, because of toxins and pesticides and chemicals. Even 5G will drive inflammation, or because you're lacking in natural substances that control inflammation in the body, like vitamin D, like vitamin C, like iodine. So it's a generalized term, but we always have to ask what's causing the inflammation, and it's always multifactorial. Again, if you find one cause, then you're a lucky person. It's usually a package of treatment that we use to control inflammation, but always start off with energy delivery mechanisms. And what's common to both those things is diet. If we don't get our diet right, then nothing else is going to work. Now, in the early days, well, of course, I didn't know much in the early days. I was on a very steep learning curve then, and I'm still on a very steep learning curve. But, I used to give people shopping lists of things to do. Oh, we do this diet and this supplement and this detox regime, blah, 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 blah. And they come back and say, well, how are you getting on? Oh, I've taken the vitamin D, I'm doing the vitamin C. What about the diet? No, not done the diet. Because that's the hardest thing to do. It's the hardest thing to do, but it's also the most important thing to do. So if we spent the next hour and a half doing nothing but talking about food and diet and gut function, and people listening to this went ahead and did that, then we would achieve a huge amount. Because diet is implicated in energy delivery mechanisms and in inflammation. The most pro-inflammatory thing you can do to your body is eat sugars, carbohydrates, and processed foods. The most anti-inflammatory thing you can do to your body is get into a ketogenic diet, because ketones suppress inflammation. And again, from the point of energy delivery mechanisms, the analogy that I like to use is the car analogy. So if your car to go, guess what? You've got to have the right fuel in the tank. And that's all about diet and gut function. You've got to have some oxygen there. and that's all about breathing techniques. Then you've got to have your mitochondrial engines, and that's my special area of interest. I've published 3 papers on this, looking at mitochondrial function in patients with chronic fatigue syndrome. We now know mitochondria are implicated in every single Western pathology you care to mention. Dementia, cancer, heart disease, diabetes, arthritis, mitochondria are centrally important. And then you have the control mechanisms of those mitochondria. So you have the thyroid accelerator pedal that controls how fast your mitochondria go. And then the adrenal gearbox, and that allows you to gear up in response to stress. And when you've got all those things in place, you've then got good energy delivery mechanisms. And that's always the starting point to treat anybody with a fatigue syndrome. It's also the starting point that we should all do just to improve our energy, because guess what? We could all do with some more energy, couldn't we? And it's also the starting point for top athletes. You can improve athletic performance by attention to those 5 things. And athletes are very driven. They're very motivated. And, I love working with athletes because if you say do it, they jolly well do it.
I love that. Will you tell us a little bit more about what the mitochondria are in this energy mechanism? Yeah, energy transport system. Yeah.
Okay.
And why they're so important.
Well, it's mitochondria that generate energy, and energy is the difference between life and death. If you've got energy, you can live. If your mitochondria switch off, you're dead in seconds. And every single living creature on this planet, bar a few, primitive bacteria, so grass, trees, sheep, dogs, cats, human, we all use mitochondria. It's a fundamental engine of life. And every living cell in the body contain mitochondria. So a heart cell will maybe contain 2,000 or 3,000 mitochondria. Muscle cells contain lots of mitochondria. And when athletes, exercise and get big muscles, what's making their muscles bigger are more mitochondria. And the more they train, the more mitochondria they can pack into their muscles, and therefore they get stronger and fitter and have more stamina. The liver cells are stuffed with mitochondria because the liver is so busy doing jobs like detoxification, maintaining homeostasis, getting rid of nasties in the body, sorting out everything that's coming through from the gut. So without mitochondria, you can't create a protein, you can't conduct a nerve impulse, you can't contract a muscle, you can't use your brain. They are the engines, and they take fuel from the bloodstream, which should be ideally in the form of ketones, and that comes from fat and fermenting fiber. Of course, they can ferment sugar. They can, burn sugar, and then they burn ketones in the form of acetate groups in mitochondria with a nasty bit of biochemistry. It's called chemiosmosis, oxidative phosphorylation, Krebs citric acid cycle. Don't worry about that. It's not important. Okay. And but the important thing is from that process you generate ATP, adenosine triphosphate, which is the energy molecule. And I think of that energy molecule ATP as money. It's money with which you can purchase any job in the body. You can synthesize a hormone, protein synthesis, heal and repair, power immune cells so they can fight infection, power the brain so it can work efficiently and quickly, power the heart so we get some cardiac output, keep us warm, allow us to run up hills. It is absolutely vital. And I mean, just to give you an idea of how important ATP is. Of course, it's recycled constantly. So it's made in the mitochondria, taken out into the cell where it's used to do a job, and then recycled back into mitochondria. If you totted up the total weight of ATP generated in the body, it's about 70 or 80 kilograms every day. It is an extraordinary process. But the amount of ATP we have in our body is about 80 grams. I mean, these are figures that just blow my mind away, that minuscule amount of ATP doing all those extraordinary tasks. And the reason, we get such high figures of 80 kilograms is it's recycled very quickly. So a molecule of ATP can recycle from mitochondria into the cell to do a job, back into the mitochondria to be converted again, back in every 10 seconds.
Wow.
So it is an extraordinary process. And the electrical gradients that are generated within mitochondria are the same as an electrical gradient of a lightning strike. So, it is an extraordinary system, incredibly efficient, generates huge amounts of energy without which, we couldn't function. So mitochondria are very important. I mean, I was at medical school in the 1970s. So you can see how old I am. And at medical school, you had to do second MB, which is the theory bit. So part of that included biochemistry. And of course, we learned about mitochondria doing biochemistry. And we all hated biochemistry. It's the sort of subject you mug up the night before on black coffee and chocolate, and then hope you retain enough to regurgitate onto the exam paper the next morning, enough to pass. Now, the reason that we thought it was such a boring subject is because it had no clinical, we weren't told that it had any clinical application whatsoever. We wanted to get out there and deal with proper patients and proper hearts and livers and cut things and all that. But we now know that mitochondria are involved in every, say, Western pathology that you can think about. They are centrally important. And the shameful thing is, you talk to any doctor and say, well, what about my mitochondrial function? They haven't even heard of them. They've forgotten it completely. They have no understanding of the importance of mitochondria. Two cardiologists I know of, Dr. Stephen Sinatra from America, bless him, he died a couple of years ago from pancreatic cancer, and Dr. Gabriella Segura, who's a cardiologist from Italy. Both of them were completely conventional cardiologists, using the drugs, the surgery, the stents, the pacemakers, all the stuff they do. Since moving to nutritional naturopathic medicine, since treating their heart failures by sorting out their mitochondria with magnesium and CoQ10 and carnitine, they are now curing their patients. They're not managing them until they have their next heart attack or until they cark it. They're actually reversing the heart disease and curing them. And this is what we should be doing. That's proper medicine. It's identifying the biochemical lesions. Are you deficient? Are you blocked? Are you allergic? Are you inflamed? If so, why? And you do all that and normal function is restored. So these techniques are incredibly powerful, but they're not easy. Everybody wants to go along to their doctor. I've got a problem, have a pill, problem solved, off they go. I mean, even when I was in general practice, I had two hats on. So I'd quickly work out if that person was prepared to, yes, roll up their sleeves, do the regimes, change their diet, try some supplements, you do a bit of exercise, concentrate or whatever. And then some people say, oh, they just want the pills and off they go. Yeah. But of course, these days, so I did, to say, 20 years as a British NHS GP, going down that path. But I eventually realized that I didn't have the clinical freedoms that I needed to be an effective doctor. In fact, because my prescribing budget was so low, because I was reversing diabetes, I was curing high blood pressure, sorting out cholesterol, all that. Because my prescribing budget was so low, I got my wrist slapped. You must be a bad doctor, not diagnosing anything, and you're not using any drugs. So, that was one of the last straws that maybe jumped sideways. So I've been working as an independent doctor since about 2001, specializing in chronic fatigue syndrome. But the awful thing now is nowadays I'm seeing more cancer than chronic fatigue syndrome. It's absolutely going through the roof. Lots of possible reasons. We can talk about that if you want. But to prevent cancer, all these things we're going to talk about today, the energy delivery mechanisms and inflammation, and you can do so much.
You had mentioned a few of the nutrients for the mitochondria. What other foods or nutrients are the most important for the mitochondria?
Okay. Well, for mitochondria to work well, their preferred fuel are ketones. So the ketogenic diet is an absolute starting point. And then in parallel with the ketogenic diet, we are all deficient in vitamins and minerals, essential fatty acids, vitamin D, C, and iodine. And one reason for that is because, we don't get enough sunshine, so we're all vitamin D deficient. Humans can't make their own vitamin C. We lost that ability about 65 million years ago, so we have to get vitamin C from our food. So the reason why my little dog Nancy, who's just lying next to me, the reason why she doesn't get scurvy from eating a pure meat diet is she can make her own vitamin C. And then there is a one-way movement of minerals from the soil, plants, animals, us, and then we throw it away. So we're not recycling human compost onto the land. And so the land itself is becoming deficient. And that is compounding by the use of glyphosate, which collates up the minerals. And our soils are becoming increasingly deficient and eroded. So that means we're all mineral deficient. And if the plants are mineral deficient, they can't make the vitamins. So we're vitamin deficient as well. So my view is we should all just have a basic package of a good multivitamin, a good multimineral, some fish oils, some vitamin C, and some iodine. That's the basic we should all take, just so our biochemistry can run optimally. But then I have what I call the bolt-on extras for particular problems. So if your mitochondria are going slow, now, okay, we can do tests to measure mitochondrial function, but they're expensive. So I tend to diagnose it on a clinical basis. So anybody with the chronic fatigue syndrome who's maybe functioning at less than 70 or 80% of their full potential almost certainly will have a mitochondrial issue. As we age, our mitochondria would go down, and mitochondria are partly responsible for the aging process. So guess what? I do take some mitochondrial supplements because I'm having a fun time. I'm enjoying life. I want to live it to its full potential. Okay. So the important bolt-on extra for mitochondria will be coenzyme Q10, 100 milligrams. Vitamin B3 as niacinamide, 1500 milligrams. Magnesium is absolutely vital, at least 200 milligrams, and magnesium needs vitamin D for its absorption, 10,000 IU. Acetyl L-carnitine, which is essential to get ketone groups into mitochondria, maybe 1 gram of that. And then for people who are very fatigued, a very useful addition is D-ribose. D-ribose is the raw material from which the body makes de novo ATP. Now, who did I learn this from? Stephen Sinatra. He wrote a lovely book called The Sinatra Solution, which is all about the importance of mitochondria in heart disease and cardiac disease. So I learned so much from him. And then from that, I went on with John McLaren Howard to develop mitochondrial function tests. So you can measure mitochondrial function and see if they're going slow because they're deficient in something or because they're blocked by something. Now, I don't think you can get mitochondrial function tests in America. In this country, Acumen Laboratories has sadly closed because John has retired, but we can get them in Europe. Professor Brigitte Koenig offers those tests, and again, they're very useful, but they're expensive. Now, I'm going to tell you a little story now, which will help explain my approach to medicine. All my patients are PBs. Now, this little bit of language derives from a newspaper article I read some years ago now about a merchant bank that wanted to target its wealthiest customers for a new investment scheme. So, and it got itself a little letter and it said, "Dear Sir this, dear Lord that," trying to persuade them to invest. And it sent it down to the mail merge department. So the scroff in the mail merge department was supposed to press the mail merge button. So all these wealthy people received a personalized letter. Anyway, he forgot to do that. So the 100 wealthiest clients received a letter that opened up, "Dear rich bastard." That's been subsumed into my language. So, wealthy patients are RBs and poor patients are PBs. They're poor bastards. And guess what? 99% of my patients are PBs because they're fatigued. They can't work. They haven't got the energy to work. So the regimes that I'm looking for have to be, affordable, doable, not take too much energy, be effective, be safe, and as I call it, multitask, do lots of other jobs as well. So, and the fact of the matter is don't wait until you get a chronic fatigue syndrome. Don't wait until you can't, run your mile in 4 minutes. Start to put in place the regimes now so you can live life to its full potential in terms of, quality and quantity. So, I do all this stuff. I know I don't have the energy I had when I was 18. But, I have enough energy to do all the things that I enjoy doing. I love working. I've got a garden, so I'm self-sufficient in food. I've got a horse that I ride. I've got a dog that I like to walk. I've got daughters, one in France, one in Brighton, which I like to see. So, I've got enough energy to enjoy myself. And that's what life is all about. It's all about enjoying ourselves.
Oh, great.
Absolutely. No, go ahead.
Oh, this is just a small little question about the niacin.
Yeah.
Does it have to be the flushing kind or can it be a non-flush?
I tend to use non-flush. The flushing kind it can be tolerated if you work at it, but many people just don't get on with it. So arguably the flushing is better, but people have got to live as well, and we need a good dose of it. So I like to use 1500 milligrams, and niacin is centrally important for mitochondrial function. And in fact, I wrote a paper for the Journal of Molecular Medicine about the importance of niacin in cardiac health, for example. And guess what? We're all deficient. And how do I know this? Well, if all, but very commonly, because we've measured. One of the early papers we did looking at mitochondrial function, one of the things we measured was, well, I routinely measured B3 then, but deficiency is almost the norm. And it's extremely common. We just don't get enough B3 on board. So that's an essential nutrient. And thankfully, it's very inexpensive and it's very safe. Potential for harm is effectively zero.
Mhm. What about the use of B1 or as especially fat soluble benfotiamine?
Yep, absolutely. That's very useful stuff. Again,
Yeah.
it improves insulin sensitivity, and it's often very helpful for mitochondrial function. So, yep.
Okay.
Again, getting well is, it's the old story. Rome wasn't built in a day.
Mm.
So we always start off with the paleo-ketogenic diet, and combine that with vitamin C and iodine to sort out the upper fermenting gut. And then if you're not making progress, then we add in the mitochondrial package. And if you're not making progress, then often, yeah, benfotiamine is a very useful bolt-on extra, 1 gram a day. In fact, there's a lovely paper in the Journal of Orthomolecular Medicine produced by Stuart Lindsay, who's a pharmacist, and he completely reversed his type 2 diabetes. And I think he said he lost 100 pounds in weight just by taking benfotiamine 1 gram daily. So yes, it's very useful, improves insulin sensitivity and also important for mitochondrial function. And if I had somebody who had a peripheral neuropathy with nerve damage, yep, I'd routinely recommend that. And guess what? It's very cheap. A year's supply costs about £50, which is, I don't know, $70 or something. Another clue is that when you get your blood report back, always look for the size of your red cells. Now, I
Mhm.
think the mean corpuscular volume, the size of your red cell, should lie between about 87 and 95. If it's much above 95, that can point to vitamin B1 deficiency, to thiamine deficiency. It can also point to the underactive thyroid. It can also point to poor methylation. But my lovely publishers asked me to do another book on test interpretation
That would be
because
awesome.
so often people get test results. In fact, people come to me with shopping lists of tests that they've had done,
Mhm.
and so much has been missed. There are good clues in there that haven't been picked up on, and so and that's an awful shame because they spent serious money on tests, and they did not do the results. So that's my next
Mhm.
job.
Yes, I
Yeah,
would love
and
that.
and I appreciate you talking about how it's just one step at a time because Natalie's a nutritionist. I've implemented the paleo ketogenic diet myself, and upon reading your book, I was a bit overwhelmed. I'm like, okay, iodine, vitamin D, vitamin C, all these supplements that I haven't been supplementing with that apparently are very important, and so it's that's such an important message to me is it's one step at a time doing these things. And so since I've got you here, I'll just pick your brain a bit with iodine supplementation. Do you have recommendations around? I know there's the Lugol's pill form, but there's also droppers, liquid form. Do you have recommendations on how to
Absolutely.
administer iodine?
Absolutely. Well, as I mentioned, all my patients are PBs, so this has got to be very, cheap and effective. So I use Lugol's iodine, 15%, 3 drops last thing at night. And again, my view is we should all be doing that. Equally, in the morning, first thing in the morning, vitamin C, ascorbic acid, 5 grams, which is about a teaspoon in warm water because it dissolves much better in warm water, slug it down. Now, these are really good treatments for the upper fermenting gut, which is a major problem because iodine and vitamin C contact kill all microbes. There is no microbe that infects us, attacks us, that is resistant to those two things. And one of the books I wrote was called The Infection Game. And it was all about, chronic infection, how we get it, and how it drives pathology. And one of the lovely things about writing books is it really makes you research your subject. And what I realized is that all cancers, all dementias, all heart diseases have an infectious driver. There's some sort of microbe that gets in there and drives that. So, for example, we know Lyme disease drives dementia. And what I'm saying to people is don't wait until you get that disease. Don't let these infections get in. Hit them hard so before they get in the first place. Prevention is always better than cure. Now, 90% of infection comes in through the mouth and the gut. So even rhinoviruses, coronaviruses, flu viruses that we inhale, they get stuck on sticky mucus, coughed up and swallowed, and they should end up in the acid bath of the stomach. and that kills them.
Mm.
Now, a major problem with people eating carbohydrate-based diets, so cereals, toast, pasta, you know what I mean, is they overwhelm the ability of the upper gut to remain sterile.
Mm.
And in that event, if you have too many sugars, too many carbohydrates, too much fruit, then those carbohydrates start to ferment. And fermentation is a disaster because, first of all, it produces lots of gas. You get wind and bloating. Makes for leaky gut, so you can't concentrate acid, so you malabsorb protein, you malabsorb your minerals that you need. And then any supplements that you do take, well, these microbes are as hungry for them as you are. So you just end up feeding those microbes in the upper fermenting gut. But what it does mean is when you do get an acute cold or a virus or something come into the body, you can't sterilize it because you've lost your stomach acidity. So taking vitamin C in the morning, 5 grams, iodine, 3 drops a night, helps to keep the upper gut sterile. And any microbes that find their way in there are instantly killed like that. In fact, at the first hint of any infection, cold, flu, snuffles, whatever, there are 2 things that I love my patients to do. The first thing is to sniff iodine. Now, this is incredibly cheap, incredibly easy. This is just a salt pipe. You can make it yourself. It's just a plastic pot. You can hear that, filled with sea salt. And then you put a couple of drops of iodine in the top. So here's your Lugol's iodine. So a couple of drops in the mouthpiece there. So you go 1, 2, give it a shake, and then sniff it. So I put my finger and thumb over the piece like that and sniff it like that. Now it smells kind of halfway between the swimming pool and the seaside. You can smell the iodine. And the important thing about that is, oh, I love the smell of it. The important thing about that is if you can smell it, then you have a therapeutic dose. Because iodine contact kills all microbes, coronavirus, flu viruses, rhinoviruses, rotavirus, the whole lot, at 10 parts per million. It's that effective. And if you sniff it, you coat the nose, the sinuses, the larynx, the pharynx, the bronchi, the lungs. So you really reduce the infectious load in the lungs. So that's the first thing you do. And the second thing you do, and again, this is work done by Robert Cathcart and Fred Klenner in the 1940s and the 50s and the 60s, take vitamin C to bowel tolerance. So I take 10 grams of vitamin C every hour. Now you might say, oh, that's a lot of vitamin C. But the point is there's a time element here. The sooner we can saturate the body with vitamin C, the quicker you will kill those microbes. Because once they're in the gut, breeding away, they breed very fast. Their numbers increase very quickly. So one of Frederick Klenner's favorite, one of quotes that I love to speak is, in all pathology, the patient should take large doses of vitamin C whilst the physician ponders the diagnosis. So if you wait till you get a doctor's appointment and then they say, oh, could be, let's wait a few days, it's wasting time. We want to get in there pretty damn quick to get rid of before that microbe, A, causes you a nasty infection that might make you ill for a couple of weeks, and B, gets installed in your body to drive pathology. And we know Epstein-Barr virus, for example, which is a very common virus. We know that drives breast cancer, dementia, lymphomas, leukemias, as well as many autoimmune conditions. It's a really nasty little herpes virus. So, always, at the first hint of any infection, get rid of it as fast as you can, and you can do that very simply. So you should have a first aid box at home with a salt pipe in it, with some Lugol's iodine, and a big bag of vitamin C that becomes part of your daily regime.
Perfect.
That's helpful. So thank you.
I wonder if you mentioned a few of the studies that you've been involved in, but can you share your thoughts on randomized controlled trials when it comes to nutrition science and their shortcomings?
Okay. Well, the point about randomized controlled trials is they suit the drug companies really well. Big Pharma love RCTs because it's easy to give a drug, it's easy to give a placebo, and you can fake the results easily. There's a lovely philosopher in America called John Ioannidis who points out that at least 95% of medical studies are faked. They are manipulated to get a desired outcome. Now, if you are a big pharma and you want to float a new drug, what you do is you give it to 10 different centers of, 10 different consultants or doctors and say, oh, I want you to test this drug. So 6, and they'll all do RCTs, and 6 will come back and say, waste of time, didn't do anything. Two will come back and say, oh, made all the patients worse. And two will come back and say, oh, the patients were a bit better. Guess which two get published?
Better.
So the only two that give a positive result, they'll get published in the New England Journal of Medicine or BMJ or something like that. And the shameful thing is those journals are no longer independent. If they don't kowtow to big pharma and do their advertising and all that, they don't get the money and they would rapidly go under. So those journals are no longer independent. Richard Smith from the Lancet once had a big drive saying all studies should be published somewhere, so that we can see the negative studies as well as the positive studies. And guess what? Big pharma said, well, we're not going to do that, are we? So the studies are faked. And whenever you look at an RCT or some sort of study, always ask the question, follow the money, who's bankrolling this? Now, of course, they are impossible for nutritional supplements because nutritional supplements don't work like that. Now, the way nutritional supplements work is they get into the body and they allow the biochemistry to work more efficiently. They provide the raw materials for chemiosmosis, for oxidative phosphorylation, and so on and so forth. So, as I call it, they reduce the biochemical friction in the system so things can flow with more easily. By contrast, drugs do the other thing. They work by blocking. They're antidepressants, they're anti-inflammatories, they're anti-cholesterol, whatever, and they block in unpredictable ways. So, as I call it, they increase the biochemical friction in the system. And of course, if you have more than one or two or three drugs, then they increase the biochemical friction in unknown and unpredictable ways. And guess what? Those side effects have never been tested. So the point here is that your biochemistry may be going slow for multiple reasons. You need a bit of selenium, a bit of zinc, a bit of magnesium, a bit of vitamin D, a bit of CoQ10, a bit of this. So giving one supplement is not going to work. And the big pharma will use RCTs with individual supplements to conclude, oh, beta carotene increases your risk of lung cancer. What a load of rubbish. What a load of rubbish. We need a package of supplements to reduce the biochemical friction, and then you'll get a whole host of benefits. So RCTs are there for the drug companies. They're not there for your good health and my good health.
Mm-hmm. I just thought of something where are there certain supplements that people should be concerned about how long they take the supplement, or especially if they're doing like a high dosage of a particular supplement because they know they have a deficiency? Is there a point where they should, retest and yeah.
Well, I know, as I say, my PBs can't afford lots of tests. Now, the bottom line is a review of, and this was done in the whole of the United States, not in Western Europe. They looked at all deaths that could be possibly attributed to nutritional supplements dating from 1980, and the answer was none. There were no deaths.
Okay.
So, nutritional supplements are intrinsically extremely safe. By contrast, now this is work done by Peter Gottschall. Now, Peter Gottschall set up the Cochrane Center in Denmark for looking at papers, overseeing them to see what are good ones, bad ones, whatever. And Cochrane reviews are considered to be the gold standard. The shocking thing is, even the Cochrane Center has now been taken over by Big Pharma, and Peter Gottschall was sacked because he was too honest. But in 2014, the Cochrane Center published a paper showing that drugs, overdoses, drug interactions, side effects, hospital medicine was the third common cause of death in America. Right. He's now repeated that paper, and it now takes #1 slot. Wow. So drugs are intrinsically dangerous. They are killing a lot of people, but that fact never finds its way into the media because guess who controls the media? So, what I would say to people is work things out for yourself from first principles. Ask yourself, what are the mechanisms? Why am I not feeling 100%? Now, do I want to suppress that with drugs? No, you don't. You want to get at the root causes. And the starting point to treat almost anything, it always starts with diet, because diet impacts on the body in so many different ways for reasons of upper fermenting gut, for reasons of allergy, for reasons of micronutrient deficiency, how much food is critical, when we eat is critical. So the starting point is the paleo-ketogenic diet. And then we move on to time-restricted eating. Why? Whenever I have a difficult question, I always go back to evolutionary biology, go back to first principles. So, what happened to primitive woman, 100,000 years ago? Did she get 3 meals a day? No, she didn't. Mm-hmm. She feasted and she fasted. And again, there's our body's response to that also has an evolutionary explanation, because what would have constrained populations, i.e., how many babies we can have and how much we can do, was food supply. That was the big rate limiting step. And so when food was abundant, and of course in the autumn it would have been abundant, wouldn't it? Because you get free fruit, free vegetables, nuts, seeds, all in abundance, pulses, root vegetables, and so on. When they're in abundance, and those are all carbohydrate-based things, it switches on the sugar crave addiction gene, and we eat and we eat and we eat them, and we get fat. And obviously fat is survival value for the winter. But what's also interesting is we get fatigued too. Mm. Eating lots of those foods and overeating those foods makes us tired. Now, that's a great evolutionary ploy, because when you've got food in abundance, you don't want to go spending it by running around and playing lots of rugby or having fun or doing lots of dancing. You want to conserve it. You want to get fat. You want to save that food for the winter. So when we eat lots of food, the result is it makes us fatigued. But by contrast, if food is short, if we're half starving, we've got to go out and hunt. We've got to go out and dig, farm, whatever. And in the short term, in the medium term, that actually gives us more energy. Mm. So fasting, and it sounds very counterintuitive, but in the short term, fasting energizes you, and feasting makes you fatigued. Mm-hmm. And people just don't get that. We all think, a bit tired, I'll go and have a chocolate bar and that'll give me energy. It does in the very, very short term, because sugar is rocket fuel, but you can't have enough without a downer. And as soon as you get a downer, you go for another sugary snack. And we know sugars, fast carbohydrates, highly processed foods give us that sugar hit, which is so damaging. So the paleo-ketogenic diet is the starting point. Mm-hmm. Time-restricted eating would be the next step, with maybe windows of time of intermittent fasting. And then in parallel with that, we sort out the upper fermenting gut with the vitamin C and the iodine. And then we can take some supplements, and they're not fermented by the upper gut fermenters. They feed us. And we gradually then improve our nutritional status. Our biochemistry goes more in a more frictionless way. And then we can really start to see improvements in fatigues, in healing and repair, and damping down inflammation. So these very simple principles, okay, they're not easy to do. But my job is to give people the intellectual imperative to do it. I mean, my patients can be very determined, and I'm asking them to do difficult things. And if they're going to do those difficult things, they've got to know why. They've got to really get it. They've got to really understand it. And once they understand it, then they can move mountains. They can do great things and start to turn everything around. And it's never too late. It's never too late to start. You've just got to take that first step.
Yeah. And you've done such a good job so far in this interview at really elucidating the importance of the paleo-ketogenic diet. I've been reading your book, Ecological Medicine, love the title. And you do such a good job at just walking people through the importance of the paleo-ketogenic diet and then what the paleo-ketogenic diet is. So could you share with our listeners what the paleo-ketogenic diet is? What are the core foods that you're focused on eating? Absolutely. What foods are you absolutely excluding?
Now, it's different for everybody, because what everybody wants to tell you is you can eat this, you can eat that, you can eat the other, and you can't have this, that, and the other. It's not that simple. And carbohydrates, they are essential foods. Sugar is essential for the body. Sugar is essential for the body because we use it to detoxify. It's the raw material to make ATP, to make DNA, to make RNA. So a bit of sugars, are essential to the body. But we can get those from eating good quality vegetables. And in fact, we can even make sugar from protein. So the diet is based on meat, fish, eggs, all the vegetables, salads, greens, some root vegetables. Don't go mad with root vegetables. Berries are ideal. Nuts, seeds. It's a very healthy diet. The problem that gets in the way, as we've already touched on, is addiction. And people rationalize their addiction. Oh, it's okay because I've always done it, you know. I can't keep going without my sugar hit or my fruit juice or my chocolate bars or whatever. So once they get the idea of the carb addiction issue, then it becomes easy. And a very useful thing to do is to measure to see if you're in ketosis. And one of the easiest way to do this is pee sticks. You can buy them from Amazon. They're called keto sticks. You can get 100 for about a tenner. And if you pee on the pink strips and they start to go a purple color, you know you're in ketosis. And then you know the foods, sort of foods you're eating to be in ketosis, and then you know you've done the diet well enough. It's called a paleo diet because I don't allow gluten, grains, and I don't allow dairy products. Now everybody says, "Oh, dairy products, they're good foods, aren't they?" They're great foods for the young, growing mammal, but they're not good foods for adults. Why? Because milk protein is growth promoting. If baby mammals don't grow very quickly, they get eaten by saber-toothed tigers. So all baby mammals have to grow very quickly, and that's why all breast milks from all mammal species are full of growth promoters so they can grow that quickly. But of course, that's a risk factor for cancer. And eating a lot of milk protein and dairy products, we know, is a major risk factor for cancer. Lovely book written by Professor Jane Plant, who is a professor of geology at Nottingham here. Now, she herself developed breast cancer in her early 40s. She had the surgery, the radiotherapy, the chemotherapy, ended up with a plum-sized lump in her breast and told, 2 months to live. Did some research. China, no breast cancer. China, no dairy products. Put herself on a dairy-free diet, and that cancer just shrunk away and disappeared. Now, she was lucky in that just dairy products did that. She went on to she wrote a book called Your Life in Your Hands. She then went on to write the plant diet because her name was Jane Plant, but she didn't get the sugar bit. She was still, she was, yes, no dairy. That was the mainstay. That's what worked for her. She did actually eventually die from breast cancer in her 70s. It wasn't the cancer that killed her, it was the chemotherapy. But if she'd gone keto as well, then I think she would still be alive today. So the point is, dairy products are growth promoting, so we should avoid those. The only safe dairy is butter. So you're allowed butter on the PK diet, and of course that's absolutely delicious. You can cook with it. Of course, it's lovely on oat cakes, on paleo bread. So that's always a great start to any meal. But these days I time restrict eat. Now, the reason I do that, so I have all my food within a 6-hour window. So I have lunch at 1 and supper at 6. So that means I have 18 hours of fasting in every 24 hours. Now, after 16 hours of fasting, you switch on autophagy or self-eating. And that's like a spring clean. It's like all those dead cells, that cellular debris that's swirling around the bloodstream, the immune system gobbles it up. But I say it takes 6 hours of fasting to switch that on. You've got a lovely doctor in America called Dr. Mindy Peltz, who's written a lovely book called Fast Like a Girl. If you can get her interviewed, she's super. Lovely videos she's got. And she again explains in layman's terms, as we call it, the man on the Clapham omnibus. So anybody can get it, anybody can understand it, the importance of fasting. Now, fasting is easy. Once you are keto adapted, it's easy. Now, you might get hungry, and about 10 o'clock in the morning, I get a bit of a rumble, and my stomach says, "Oh, go and have a snack." I ignore it. I ask myself, is the brain working well? Guess what it is. Is the body working well? Guess what? Yes, it is. Ignore the grumbles, and they go away. And as Hippocrates famously said, the best possible sauce you can have for any meal is hunger. And if you go to the table hungry, that food tastes absolutely fantastic. I'm not a brilliant cook, but I really enjoy my meals when I'm hungry.
Absolutely.
That's so good. Well, and I wanted to talk a bit more about dairy. Over the last 3 years, I've done a lot of gut healing and really done a ketogenic diet, but I have included dairy for myself. I've included primarily it is butter. But I do have some cream, the highest source I can find. I do eat cheese sometimes, and I eat like the highest quality cheese I can find, raw milk, fermented more traditionally. What are your thoughts on some of those dairy products that are higher quality, and maybe cream, for example, that's higher fat as well?
Okay, well, the point is, first thing, I presume you're not dairy allergic. If you're dairy allergic, with snotty nose, asthma, migraine, then obviously you'd want to avoid them. But, the occasional treat is fine. Am I a paragon of virtue? No, I'm not. When I go out for a jolly with my friends, I know I like to have a gin and tonic because my jokes are much funny when I've had a gin and tonic. So, you don't have to be a paragon of virtue. So the occasional is absolutely fine. It's not going to be a problem, but just don't make it a staple. I mean, I remember I had a guy who came to see me who was a consultant anaesthetist. And before he'd even sat down, he said to me, I'd like you to know that when I die, I want to take a cow to heaven with me. And that was his way of saying, I love dairy products. Now, allergy and addiction are two sides of the same coin. And if I've got somebody who comes in and they have, cereals for breakfast, and then toast, and then biscuits mid-morning, and then sandwiches at lunchtime, and cake in the afternoon, and pasta in the evening, it's wheat, 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 wheat. Almost certainly they're allergic to wheat. It's the same with dairy products. And what's interesting with the children, especially, is they very easily get addicted to their allergy food, but they often have, and it's often dairy, but they often have likes and dislikes within the dairy. So they'll love milk, but they'll hate cream, or they'll love cheese, but they'll hate butter. I don't know why that should be the case, but it's a common observation. So if you've got a kid who absolutely goes for a particular food, they've probably got a problem with it. And of course, we love giving our children the things that they love, but it doesn't mean it's good for them. Now, a very dear friend of mine, all 6, 7 years, 8 years ago, she moved to live in area. So she became a neighbour the other side with her husband. Her husband, Peter Wilson, won the Olympic gold medal at the London Olympics for the double trap. That was shooting. And they came here so he could train at the brilliant shooting school we've got opposite here at Griffin Lloyd. And they'd been married for some time, and were not conceiving, just not having babies. So Michelle, obviously she's like me. She loves gardening, horses. So she came over most days, or I went over there, or whatever. And of course, she heard me talking enthusiastically as I do about the PK diet, and she did the PK diet to the letter. Within a few months, she was pregnant. She continued her paleo-ketogenic diet throughout pregnancy, and she's now had 2 girls. One's my goddaughter, who are now aged 6 and 5, and she raised both girls on a paleo-ketogenic diet. Now, what's so fascinating about that is that from a very young age, both girls slept. So they would, from a few weeks of age, they would go to sleep at 7:30 in the evening, and she would have to wake them up at 8 o'clock the next morning. Why? Because Michelle was breastfeeding them. Michelle was peak paleo-ketogenic, so her breast milk was very low in sugar, but very high in fat. And of course, fat is highly nutritious. And babies are all born fat, aren't they? They're chubby, they've got lots of fat on them. They need all that energy for growth. And, you don't want to restrict their food supply because they're growing fast. But if you feed them fat, they don't get hungry. So both girls have slept through the night, since a few days of age. That's the first thing that's so fascinating. So Michelle reared 2 girls and didn't miss a night's sleep. The second thing that's fascinating, and again, I didn't know this when my girls were when I was feeding my girls. It's just taken as a norm. Oh, you feed them, and then you burp them, and there's a bloop, up comes the burp, and then my shoulder constantly had a white splodges all over it because that was a little baby vomit spewing onto it. Michelle's girls never did that. Didn't happen. No posseting, no hiccups, no burping. They just had their milk, and that was it. They lay down and went to sleep again. And again, it's almost, and of course that burping is upper fermenting gut, isn't it? Mm-hmm. Because the breast milk, if you're eating lots of sugars, there's going to be lots of sugar in the breast milk. Bottle-fed babies, it's just milk and sugar, isn't it? Mm-hmm. And so early on, these kids, their gut gets inoculated probably with yeast or maybe bacteria. They're fermenting away, they're burping, they're posseting, they're getting pyloric stenosis, and this is all upper fermenting gut. And it's almost taken as a norm that babies get thrush in the mouth. that they get cradle cap in the scalp, that they get nappy rash. These are all fungal infections.
Mm.
So if we feed our babies all this sugar and all this sweet breast milk, we're giving them infections from day one.
Mm-hmm.
And that's not good news. Fungal infection. In fact, it's a lovely book that you might be interested in by Mark Lintern. Now, he himself had cancer and he wasn't educated in health. He just went back to first principles to look at what's driving cancer. And he came to the view that the vast majority of cancers have a fungal driver.
Mm-hmm.
And that makes perfect sense to me because the treatment of cancer or the way to prevent cancer is stop feeding it. Yeast can only run on sugar, cancer cells can only run on sugar. So the starting point to prevent and treat is the paleo-ketogenic diet. Don't let the yeast get in there in the first place. Kill it in the gut with iodine and vitamin C. If you've got cradle cap, psoriasis, irritable bladders, these are all yeast fungal driven pathologies. So you've got to get rid of the wretched stuff. So say, don't wait till you get nasty pathology. Get on with it now and do it now.
Yeah. Oh, I love that. Oh, I want to ask more about the ketogenic diet a little bit more, but I could go off on the rabbit trail too of if people are getting recurrent fungal infections, even after they're using some of these supplements like iodine, what would you say is going on there? Is there something else that's being missed, or is that something that they just need to continue to take for a
Well,
regular time?
once you've got a fungal infection, I mean, it depends where is the fungal infection. So if it's on the
Mm-hmm.
skin, then I would use topical iodine. So for athlete's foot, cradle cap, a nappy rash, then what I do is I recommend mixing iodine with coconut oil because
Mm-hmm.
coconut oil is a bioidentical fat, and that will kill the fungus, and then it gradually grows out. So you can get rid of toenail fungus, skin fungus, athlete's
Great.
foot, jock itch, all those things with topical iodine. But of course, at the same time, you do a ketogenic diet, so you're starving them from the inside and then killing them with the iodine.
Mm-hmm.
If you've got iodine fungi, upper fermenting gut, it's commonly yeast that does that. The next step, if the iodine, the vitamin C isn't cutting, is I use MSM. Again, it's a great treatment for my poor baskets, for my PBs, because it's very cheap.
Mm-hmm.
And MSM, and this is work that I learned from a lovely American doctor called Dr. G.I. Janelle, Janel. Again, you must have her on your podcast if you can.
Okay.
And the point is we're all sulfur deficient. And sulfur is
Okay.
such an important
Mm-hmm.
part for the detoxification, for connective tissue, for the immune system, for healing and repairing the gut, and much more. And MSM is the biologically available form of it. And she recommends a window of time of 2 or 3 months of maybe 2 or 3 teaspoonfuls daily to restore a sulfur deficiency, but it's very good for the gut. And what's so interesting about that is the upper gut, the stomach, which is oxygenated, which is aerobic. In an oxygenated environment, it kills the fermenters, but in the anaerobic environment of the large bowel, it feeds them. And that's a very useful double whammy because we want
Perfect.
the first 25 foot of butt gut to be near sterile and the last 5 foot, the microbiome, to be full of microbes that are happily fermenting away. And in
Awesome.
addition to that, sulfur helps pull out hot toxic metals and heavy metals, and many people are toxic with metals. As I say, it's essential for connective tissue. It's good for fourth phase water, which is another one of my favourite subjects, and it's dirt cheap. So that would be the next place to go if you're not cutting it with the vitamin C and the iodine.
That's a great connection there too for me because I've always seen that yeast is really abundant in people who have toxic metals like mercury fillings and things like that. So it's there for a reason, but if we can get after both root causes, that getting the sulfur, the MSM, getting after detoxing the metals and completely fixing that
Correct.
upper fermenting gut, that's perfect. So wonderful.
I mean, a better form of MSM is DMSO, which is another one of my favorite works really well, but it does make you pong a bit. And of course, whenever I try have a new tool, I think, well, I've got to try this on myself. So of course, I got some DMSO and I was slugging back, 20 mils a day and think, oh, this is great, this is working really well. Until I went to visit my daughter in Paris. And so I got on Eurostar, went across, oh, Claire, hi. And she came, and then she leapt back about 5 yards. Mother, she said, you stink. And of course, It was the DMSO. Now, I'm ashamed that I hadn't noticed the smell. I do notice it on other people when they're taking it, but it doesn't trouble me. It doesn't bother me. But some people really don't like it at all. So if the DMSO doesn't suit, then MSM is the next best thing.
Yes, yes. Do you see a lot of clients? So, with fibromyalgia, or sorry, with chronic fatigue syndrome, there's some people who also have fibromyalgia. Do you have any effective treatments for that work in conjunction with the ketogenic
Of course, of course.
diet?
But
Yeah.
again, of course, but again, fibromyalgia is not a diagnosis. It's a clinical
Right.
picture. And
Right.
we have to ask the question why.
Good.
And there are more than one cause. Now, one obvious cause is poor energy delivery mechanisms. Because if you haven't got the energy for muscles to work, then they will go into anaerobic metabolism. And when you go into anaerobic metabolism, you produce lactic acid, and that is very painful. Now, of course, if you've got a patient with angina, then they go into anaerobic metabolism very quickly because the blood supply to the heart is so awful that you can't get the fuel and you can't get the oxygen to mitochondria. You go into anaerobic metabolism, produce lactic acid, and that's called angina. And it's a very painful, crushing central chest pain, often exercise related.
Mm.
When you stop exercise, when you stop doing things, the pain dissipates over a couple of minutes. And that's because that lactic acid is converted back to acetate. Now, when you've got somebody with chronic fatigue syndrome and fibromyalgia, they can't do that because when you go into anaerobic metabolism, from one molecule of acetate, you get two molecules of ATP. If you send it through mitochondria, you get 36 molecules of ATP. But if you burn it anaerobically, you only get two molecules. It's a rotten return. And then to get those two molecules of lactic acid back to pyruvate and acid, and that's called the Cori cycle, that takes six molecules of ATP.
Wow.
So when the chronic fatigue syndrome patients do too much, overdo things, and of course sometimes you have to, they go into anaerobic metabolism, they produce lactic acid, which is very painful, and then they get stuck with it because they haven't got the mitochondrial function to make the ATP to get it back. So fibromyalgia can simply be caused by poor pacing. It's very boring pacing, but if you don't pace, you go into anaerobic metabolism and make things much worse.
Mm.
Another common cause of fibromyalgia is allergy to microbes from the upper fermenting gut. Now, we've
Mm.
touched on the upper fermenting gut, but the microbes in the upper fermenting gut are not familiar. They're not the ones that we've been looking at from an evolutionary point of view for decades. And one of the problems with them is those microbes get into the bloodstream and they get stuck at distal sites. They get stuck in muscles to drive fibromyalgia. They get stuck in joints to drive arthritis, like psoriatic arthritis, which is fungal driven, like rheumatoid arthritis, which is probably Proteus mirabilis, like
Mhm.
ankylosing spondylitis, which is driven by Klebsiella. And so those allergic reactions in the muscles drive inflammation. So, and inflammation is always painful. It might be something simple like magnesium deficiency. It might be allergy, or or any part of the body can react allergically. And one of the commonest clinical pictures is what I call allergic muscles. Now, I have allergic muscles. If I have dairy products, I get the most excruciating back pain. And when I've got it, I look like a right old hypochondriac because one moment it's okay, and then the next moment the muscles cramp. I'm oh,
Oh no.
somebody do something to agony. It is agony.
Oh.
And of course fibromyalgia, and that can extend to the shoulder muscles, the arm muscles, or whatever. So again, always think allergy with fibromyalgia. It might be foods, it
Mhm.
might be allergy to microbes in the upper fermenting gut. There are no good tests for allergy, and sometimes the most useful starting point is to do a carnivore diet.
Mhm. Mhm.
Nothing unhealthy about carnivore diet. It's a very good starting point. You can be allergic to meat, but it's unusual. But if you're eating meat and doing your vitamin C and iodine, the potential for fermentation is pretty much zero.
Mhm.
And that massively improves upper gut function. In fact, a very dear friend of mine is a consultant psychiatrist still working in the NHS up in Scotland. And her starting point to treat all psychiatric conditions is a carnivorous diet, a carnivore diet.
Mhm.
Now, This has been known about for decades. You're probably aware of the work of Abraham Hoffa and Carl Pfeiffer, two psychiatrists who were not controlling, not managing, they were curing psychosis and manic depression with ketogenic diets and then supplements like niacinamide, like fish oils, like magnesium. There's some lovely work done by a Japanese researcher called Nishihara. And what he's demonstrated is if you've got fermenting microbes in the gut, you've got those same fermenting microbes in the brain. They probably get there via the vagus nerve. And those microbes in the brain can ferment out neurotransmitters like adrenaline and noradrenaline and serotonin into LSD and amphetamine like substances. And this may be the basis of psychosis. Wow. And as soon as you stop the upper fermenting gut, you stop the fermenting brain. And as soon as you stop the fermenting brain, you get rid of your psychosis. Now, it's difficult for psychiatric patients to do this because having a psychiatric condition is incredibly stressful. And, and I was aware of this even as a medical student, even in the 1970s when we were going around the psychiatric hospitals then, again, looking back, all the, inpatients there were using addiction to deal with their stress. So they're eating biscuits, smoking, chain smoking, drinking coffee like mad. And okay, alcohol was banned, but if ever they escaped, they went straight down to local boozer and got sloshed. Why? Because in the short term, addictions relieve us of many of our uncomfortable, stress-related symptoms. But of course, in the long time, they're a disaster. Mm-hmm. So by dint of doing, ketogenic diets, cleaning up the upper fermenting gut, taking some essential nutrients like, say, B3 and so on, you can cure psychosis, you can reverse schizophrenia, and you can also treat dementia. So it just illustrates the power of these interventions to do stuff. But I think a lot of fibromyalgia is simply allergy to microbes from the upper fermenting gut. A very good example of this is polymyalgia rheumatica. Again, it's a clinical picture. We're seeing a lot of it. How do the conventional doctors treat it? Steroids, because steroids wipe out allergy. But in parallel with that, you must do all these regimes because I think polymyalgia rheumatica is allergy to microbes from the upper fermenting gut. And you put in place all these things and it just melts away.
Makes a lot of sense. Yeah. Mm-hmm.
Yeah, Dr. Chris Palmer is another great psychiatrist here in the States out of Harvard who's been treating patients and literally reversing patients who have schizophrenic symptoms, which you wouldn't think hallucinations or delusions could be reversed by diet, but his clinical experience is literally showing this. So it's an exciting time where psychiatrists and physicians who are forward thinking are starting to use these interventions like you have. I wanted to track back really quickly to the keto protocol, and you were saying you recommend using the urine strips to assess. I've heard you talk about the breath devices in the past. Do you still recommend those as well? Because I know we've done the blood. It's accurate, but it's expensive. Could you just talk a bit about that assessment method?
Yeah. Breath testing are very good. There are different things you can get. You can get cheapo meters, about 40 quid, that give you a good idea. There's an expensive one called Ace Track. That costs about 200 quid, but that's more accurate. But these days, I don't bother to test myself because, I know what I have to do in being ketosis. I know the symptoms of being in ketosis, and one of which is, your teeth remain very smooth because you don't get any dental plaque building up on them. You sleep well. You don't get energy dips. You can do intermittent fasting with no problem at all. The brain is very sharp. You don't get sugars uppers and downers. Okay, I do occasionally test, but but testing is very useful because then at least you've done it properly. And people always say to me, "Oh, how many ketones do I need? Or what should I be blowing?" And the answer is any positive result will do. Because you see, sugar is so damaging to the body that if you've got excessive amounts of sugar away, the body will always burn it off as a fuel first. So it gets sugar out the way by burning it off with exercise. And if you're type 2 diabetic and your blood sugar spikes, just going for a good walk is the quickest way of bringing your blood sugar down because the muscles just fry off that sugar pre-DQ. Having got rid of that sugar, your body then goes into fat burning mode and produces ketones. So any amount of ketones will do, because if you're blowing ketones, it means you've burnt off all your sugar and you're in fat burning mode. So the actual figure is not critical.
Mm. Have you ever seen in practice? I've had a couple clients that are just kind of anomalies with the ketogenic, like they've been in ketosis for maybe there's been a couple people who are just very new to being in ketosis, and then some people longer term in ketosis where their blood sugars start to elevate. And it's usually in the morning though, but not throughout the rest of the day. Is this an indicator that they're not sleeping well?
Okay.
Not getting
Almost,
deep sleep.
almost certainly you're describing what's called ketogenic hypoglycemia.
Hmm.
Now, in order to be able to fat burn, you need thyroid hormones. If somebody is thyrotoxic, if they're overactive, the weight drops off them. Why? Because they go into massive fat burning mode and burn off all their fat. So we need thyroid hormones to fat burn. Now, the underactive thyroid is very, very common. And if you haven't got the thyroid hormones to fat burn with, then you fat burn with adrenaline instead. Now,
Ah,
remember, the symptoms of low blood sugar are not symptoms of low blood sugar. And to give you an example of this,
right.
the two explorers from this country, Ralph Fiennes and Mike Stroud, decided to walk to the south across the Antarctica via the South Pole unaided. Now that's an extraordinary thing to attempt. It's 700 miles of temperatures dropping down to -50 -60 degrees, and they had to carry all their food with them on sledges and tents and all that sort of stuff. So it's a massive demand. And of course they took the most energy dense food, which is fat. Lots of butter, coconut oil, chocolate, all those things to power themselves. So they're in permanent ketosis during this expedition. Now, Mike Stroud is a GP, and on the trip, he took bloods, just to see what's happening in the blood. And on occasions, of course, they were all in huge ketosis, both in massive ketosis throughout. But their blood sugars would sink as low as 1 millimole per litre. Now, you would think that you'd be blacked out and unconscious with levels that low. But of course, they weren't because they had lots of ketones. So it illustrates the point, you can function perfectly well with very low blood sugars so long as you are in ketosis and in fat burning mode.
Mhm.
So the symptoms of low blood sugar are not symptoms of low blood sugar, they're symptoms of adrenaline.
Mhm.
And when people's blood sugar drops, they're pouring out adrenaline. What does adrenaline do? It mobilizes sugar from glycogen stores, so then the blood sugar goes shooting up again. So you end up back on the blood sugar roller coaster, as I call it. But if you've got thyroid hormones, that's not a problem. So my guess, Natalie, is that those patients have an underactive thyroid and they
Mhm.
can't fat burn with adrenaline. Now, I've written a book about this. It's this one here. It's called The Underactive Thyroid, and the subtitle is very naughty. The subtitle, I was expecting to get loads of complaints from the General Medical Council. The subtitle is Do It Yourself Because Your Doctor Won't.
Mhm.
And the shameful thing is, that is true. Doctors no longer know how to diagnose. They just treat blood tests with simple algorithms, and those algorithms are all wrong. They often just look at the TSH, which, yes, that will pick up primary hypothyroidism, but it misses secondary hypothyroidism when the pituitary is down. It misses poor conversion T4 to T3, and of course, it's T3, which is the active hormone, and it misses thyroid hormone receptor resistance. So it misses at least a half of the real cases of the underactive thyroid. So, thankfully, we can get thyroid glandulars online and they do not require a prescription. And these comprise of whole desiccated thyroid, which is biologically active and provides bioidentical hormones. And in the appendix of that book, I detail all the sources you can get in the world. But so the way we diagnose the underactive thyroid is, first of all, we look at the clinical picture. Do you have any symptoms of hypothyroidism? Which would be fatigue, obviously, foggy brain. It's a risk factor for dementia, heart disease, and cancer. Fluid retention, so puffy eyes, swollen tongue, carpal tunnel syndrome, puffy face, crease marks on the sheet when you wake up in the morning, loss of hair, loss of the outer third of the eyebrows. These are all a slow pulse at rest. These all point to a clinical picture of the underactive thyroid. So if you've got that clinical picture and all the symptoms, of course, in the book, then you do a blood test. And I want to look at the level of TSH, thyroid stimulating hormone, the level of T4, the level of T3, and that tells us if there's biochemical scope for a trial of thyroid hormones. So, the normal reference range for a free T4 is maybe 12 to 22 picomoles per liter. So you could have a free T4 of 12.1 and you'd be told by your doctor, oh, you're normal. You're in the normal range. Everything says well. But your personal normal range might be 20 to 22. You might function much better at 20 to 20. And the only way to find out is to suck it and see. So the book tells you how to recognize the clinical picture of thyroid hormones, the blood tests we need to make sure that you're not overactive and that there is biochemical scope for a trial of thyroid, and then how to use thyroid glandules like Metavive, like a natural desiccated thyroid, like Thyroid S, like Armour Thyroid, how to use that in low doses and build up slowly to hit that sweet spot. And I can tell you that has transformed the lives of hundreds of thousands of people worldwide because they've done it themselves. They've been to the doctor, had the blood test, told, oh, nothing wrong, off you go, but are transformed when they take thyroid glandulars. So that's very useful to know. But the point is, we have to do this in a certain order. So I know what half your listeners will do. I think, right, oh, I've got undirected thyroid, I'll go and get some. Thyroid hormones work through their action on mitochondria. Mitochondria need the right fuel in the tank and the raw materials from the diet and by sorting out the upper fermenting gut. So we always start with the diet. And having got the diet in place, then we sort out the upper fermenting gut. And once the upper fermenting gut is in place, then we can tolerate some supplements and we know they will be absorbed and go into the right place. And if you're very fatigued, you might need the mitochondrial package. Then you can start looking at the thyroid gland. Because, as I say, if the mitochondria are not in a fit state to respond, then you can take the thyroid hormones, which will beat up the mitochondria, but they can't go any faster because they're deficient or they've not got the right fuel. So we have to do things in the right order. And yes, it takes a bit of time. And yes, but these benefits are for life. And you put all this in place and you protect yourself from heart disease, cancer, dementia, degenerative conditions, and much more.
Absolutely. Thank you so much for explaining that. That's definitely the clinical. It matches the types of clients that I'm thinking of. That well, and we have been working on their thyroid with the iodine and the nutrients that are supportive to the thyroid. But it's interesting. It's too soon. It's like when they first start, typically that this issue is happening. So.
Well, you can do all this stuff quite quickly. I mean, we're not talking about months to get people well. You can be keto adapted in a couple of weeks. You can sort out the upper fermenting gut in a few days. As soon as you stop feeding the little wretches and killing them, you will stop fermenting. Then you can get the nutritional supplements on board. Okay, it maybe takes some weeks or months before they're really incorporated and used, but you can put the mitochondrial package in place quite quickly, and then you can get on with the thyroid. So we're not talking about months and years to turn these patients around. We're talking about, days and weeks to turn things around. And but we have to be careful because, as I'm sure you're aware, when you put in place any of these interventions, you can trigger what we call a healing crisis. I call them D reactions: diet, detox, and die-off reactions. And there's a whole page of it on my website. And the sicker the patients are, the slower you must go. Yeah. Because, with iodine and vitamin C, you can trigger a detox. By doing a keto diet, you can get keto flu. As soon as you start to kill off microbes, you can get Herxheimer or die-off reactions. And some people are so sick, they can't afford to be made worse. So we have to be nice to ourselves. We have to go slowly, build it up gently. And if you do get such a reaction, then see that as a good sign. Okay, I know it's uncomfortable. I know it's painful, but at least we're nudging things in the right direction.
Right. I want to be conscious of our time. We have like 10 more minutes left, but I wanted to ask if you wanted to talk more about ketosis or sorry, not ketosis, cancer,
Okay.
or chronic fatigue syndrome.
Okay, well,
We have all kinds of questions for chronic fatigue syndrome, but you said that you're seeing more people with cancer now.
That's right, yeah.
Yeah.
Now, I don't pretend to treat cancer because if I go out there and say I'm treating cancer, then I can be thrown in prison for that. The 1939 Cancer Act that was passed in this country basically said that only oncologists can treat cancer. If anybody else claims to treat cancer, we were going to throw them in prison. Okay, so I don't treat cancer, I treat people with cancer. Because what we need to do is there is potential for our immune systems to kill the cancers within us, and that's what we must do.
Mm-hmm.
So the first thing we have to do to prevent and tackle this is stop feeding cancer cells. Cancer cells can only run on sugars and carbohydrates. This was known in the 1930s. German physiologist called Otto Warburg demonstrated that the difference between normal cells and cancer cells is cancer cells can only run on sugar. So this is where the ketogenic diet is really, really, really important. Because the fact of the matter is we're all producing cancers all the time. Throughout life, just from background radiation, that's generating about 10,000 mutations every second. Now, thankfully, we have systems in place for healing and repairing those DNA mutations. But the most important mutations aren't taking place in genomic DNA. They're taking place in mitochondrial DNA. Now, a classic experiment took two cell lines, a cell in vitro, which were normal cells, and another cell line that were cancer cells. Now, if you took the nucleus of the cancer cells and put it in the normal cells, the cells remain normal. If you take the nucleus of the normal cell and you put it in the cancer cells remain cancerous. So what that tells us is it's not genomic damage in the cell nucleus, it's something in the cytoplasm. And we now know what that something is, and that is mitochondria. And mitochondria have their own DNA. Now, mitochondrial DNA is spherical. They're well, not spherical. They're ring shaped, and it's not separated off in a separate nucleus. It's contained within the mitochondria, mixed up with all the energy generating processes. Now, the business of generating energy is never 100% perfect. There's always some mistakes there, and those mistakes are called free radicals. Free radicals are molecules with an unpaired electron. They're very unstable. They will stick onto anything and damage them. And we mop those up with antioxidants. I'm sure you've heard of these words. Now, one of the most important antioxidants in mitochondria is melatonin. And melatonin, we know, is very good at preventing and treating cancer. And as we age, arguably, we should all be taking some melatonin. And I would recommend 20 or 30 milligrams at night. And again, it's very cheap. You've got a wonderful company in America called Piping Rock, where you can get 10 milligram melatonin tablets very inexpensively. 30 milligrams at night will be highly protective. So, having established that cancer is a mitochondrial disorder, what we have to do is we have to look after our mitochondria. So we feed them ketones, and that is the starting point. Guess what? Vitamin C kills all cancer cells. So taking vitamin C 5 grams a day is going to be highly protective. Guess what? Iodine kills all cancer cells. So taking 3 drops of Lugol's iodine last thing at night is going to be highly protective. Guess what? Autophagy kills cancer cells. So we want to switch on self-eating or autophagy. So that's why we do time-restricted eating. So if we start off by eating all our food within a 6-hour window, and you do that as a routine every day. And then once a week, I skip lunch. So I have a 24-hour fast. And then once every 3 months or 4 months, I do a 3-day fast. And, people are horrified by the prospect of fasting. I mean, I had a lovely guy who was a serious RB, who I was talking to about doing the paleo-ketogenic diet, and he said, "Well, I'm kind of doing it, but I've really got really stuck with my weight loss." Oh, I said, we can kickstart that with time restricted eating and maybe do a 3-day fast. And there's a long pause, and he looked into the distance and he said, "I'm afraid of being hungry." Now, nobody had ever said that to me before. And I thought that's fascinating. And his fear of hunger kind of traces back to childhood when he wasn't loved. He wasn't adored by his parents. He didn't get regular meals, and he was often hungry. And that kind of fear, has stayed with him. And in his adult life, very successful businessman, but he still had that fear of hunger. But if you analyze it, I do get hungry. Of course, everybody gets hungry when they're fasting. But you ask yourself, is the brain working well? Yes, it is. Is the body working well? Well, actually, yes, it is. The hunger is just your stomach saying, I'd like some food in there. Ignore it and it goes away. And a 3 day fast is easy. Because guess what? When you have a fasting 3 days, you don't have to go shopping. You don't have to cook. You don't have to lay the table. You don't even have to do the washing up. You have more time to do all your other stuff. So it's easy. It's in there. It's psychological. That's the only barrier. And okay, I'm greedy. I love food. But guess what? When I break my fast, I really enjoy that meal. And Thomas Levy and Thomas Seyfried, two cancer experts in your country, I'm sure you know them well. Intermittent fasting is a great way to reduce cancer. And when you've got somebody who's got cancer, obviously, if they've presented with the lump, obviously we've got to reduce the tumor load. And yes, of course, we need surgery to get rid of the most of the tumor, and maybe chemotherapy and maybe radiotherapy to reduce the load. But you see, people don't die from the primary tumors; they die from the metastases. And there's nothing like having a cancer to really motivate people to do these regimes. And the regimes I use, they're on my website. They're free. Anybody can access them. But it's all the stuff we've been talking about. The ketogenic diet, the intermittent fasting, vitamin C, iodine, maybe MSM. There's nothing clever about this. And then we monitor it with cancer markers. So all cancers have got a marker. If you've got prostate cancer, then obviously a PSA. If you've got leukemia, then obviously a white cell count. If you've got breast cancer, then maybe a CA19. So we can monitor to see the result. And there's a lovely book that's been published recently by Paul Marrick, who's one of my vitamin C experts, looking at repurposed drugs to treat cancer. And again, many of these are flagged up by Mark Linton in his book, The Cancer Resolution or Resolution. And this makes perfect sense because all cancers have an infectious driver. And all these drugs are either antifungal or antiparasitic or antibiotics. And there's fantastic case histories, lots online. Ivermectin, curing esophageal cancer. Fenbendazole or mebendazole, the same. Antibiotics, doxycycline, azithromycin, the same. Ivermectin, the same.
Yeah.
So, this is really interesting because these are all totally non-toxic interventions. You can't do any harm with these. We can monitor the results with cancer markers and reverse these cancers. But we have to do the whole thing. As I said, this is not a battle, it's a war. And, I now have many patients who are living with their cancers, brain tumors, ovarian tumors, breast cancers, bile duct cancers, and they're functioning at a very high level and living with their cancers. And my guess is they probably won't die from them. They may die from something else, but they're doing very well, very well at the moment. Thank you very much.
Amazing. Yes. So, and I'm imagining so much of what you're saying, right? For specifically the cancer treatment can also be used for chronic fatigue syndrome. I see a lot of clients with these kinds of issues too. And it is the strategy of, basics first, right? With the diet that you're saying, really focusing on the mitochondria first, and then these other medication type things. Do you think if somebody treated cancer traditionally because they didn't know, or like the conventional treatments because they didn't know about these things, and now they know about the diet, should they do it? They should start now, right?
Of course.
Yeah.
It's never
Okay.
too late to start. And we know cancers have a horrible habit of, coming back, and biting in the butt when you thought you got rid of them. And also, the biggest risk factor of having a cancer is having had another one previously. So, you maybe you've had a melanoma in the past or skin cancer in the past, and then a breast cancer pops up, and maybe, and then maybe a lung cancer follows that, and these primary tumors, because they're all caused by the same thing. It starts with sugars and carbohydrates. So, starve the wretched thing out and stop yourself getting another primary and stop yourself getting a metastasis, and say, don't wait till you get a diagnosis, do it now. But what gets in the way is addiction. It's addiction to cigarettes, to alcohol, to sugar, to fast carbs, or whatever. So we have to recognize that we're addicted. Get off those addictions. So important. Ask ourselves the questions, why are we addicted? Because we use addiction to deal with stress.
Mhm.
And, and stress is very unpleasant. I mean, when I was being done by the General Medical Council, I had to have a couple of glasses of wine every night just to give myself, a window of time where I could just relax a little bit. But, it didn't do my health any good at all.
Well, Dr. Myhill, we could talk to you for another hour and a half. Thanks so much
Thank
for
you.
taking the time to share all of your wisdom with us, with our listeners. If folks are interested in learning more about your work, we've mentioned Ecological Medicine, the book that I referred to, The Underactive Thyroid. I know you've published a number of other books. Where's a good place for people to learn more about your work?
Well, I mean, on my website, that's the website's now had 30 million hits. It's got 500 pages. There's lots of useful stuff there. There's also one page that details all links to all the podcasts and interviews I've given. I personally prefer to learn by reading books. I think Chelsea Green in America published many of these.
Great.
It's expensive to post them from here, so but you get them on Amazon. That should be possible. But as I say, everybody likes to learn in a different way. Some people like to listen to videos, like podcasts like this. Some like to read books. But it's on my website as well. So lots of options. And I also run workshops. I do Zoom online workshops where I talk all day about chronic fatigue syndrome and ME. So as you've gathered, I'm gobby. I can talk a lot. So I start at 9 in the morning and I keep talking till 4 o'clock in the afternoon with a break for lunch. And anybody can join those. We max out about 20 people. So anybody can ask any question anytime. And they're good fun. We have people from America, from Japan, from Australia, from all over the world. I think they cost 40 quid, so they're not too expensive. And then I run workshops at my home where people come. And of course, I feed them a paleo-ketogenic diet. And I talk all weekend, Friday, Saturday, Sunday, and we cover the whole of medicine. And increasingly, I've had invitations to speak in Poland, in Madeira, in Morocco. So there are some overseas jollies as well. So if you want to combine it with a hot holiday, we can have some fun doing that.
Mm.
Great.
Wonderful. Thank you so much.